according to first major parliamentary investigation that in the UK, faced with uncontrollable pain and unbearable pain, whether palliative care cannot be corrected alone, and whether assisted dying must be legally legalized. With a shocking presentation in favour of a change of law, Molly Meacher said to the Commons Health and Social Care Committee, "Vomiting stools, endless nausea, and so badly smelling tumors from hospital wards. People present, they do not live, crossbench peers, and charitable honour." House of Commons in 2015 after last changing legislation 8 years later in committee investigation of committee investigation. The opening declaration said that this is an issue that is incredibly sensitive and affects us all. We die in this way. Ilora Finlay, crossbench peer and palliative care doctor who discussed strongly against any amendment of the law, described a patient who would kill himself in 2 weeks, but 11 years later.He said would go on journey, and he went on 3 such journeys before. Authorized warned that risk, elderly abuse KM is worsening due to change law and said that the wider existence irregular palliative care in UK should be a priority instead. Priority.He said it could result in 5,858,000 assisted S per year, depending on it. Such demand, every assisted will include approximately 60 hours of clinical work, saying that NHS clinicians will direct a already stretched labour force, he said. Nausea, vomiting and mushrooms tumors can be increasingly smelling, he added. In accordance with the 1961 suicide law in England and Wales, it is a criminal offence to encourage or help others suicide. However, guidance of Crown Prosecutor's Office, victim had had a voluntary, open, established and informed decision and suspect was completely motivated by other things. The population of England is getting older. 1 in 4 people was estimated by 65 years or more by 2050. Meanwhile, according to 2019 to 20 National Maintenance Inspection, the palliative care service that lacks 2/3 of hospitals in UK and Wales is 8 hours a day and 7 days a week. Charles Falconer, a worker peer and former Lord Chancellor, explained the current situation in which dying people sometimes withdraw their own treatment instead of taking medication to end their lives.He suggested that it should be available only for fatal people. Paulette Hamilton, a deputy and committee member of the worker, said he was worried about watching the systems he saw in Oregon. Paul Blomfield, a worker deputy, was a visible emotional when his father told him how it was among the 650 patient people who took their own lives every year. Only, often very difficult and my father was one of them, he said. Actually, he took this decision shortly after sitting with a Macmillan nurse and experienced what his last months could look like. Sheila Hollins, a crossbench peer who opposes assisted, warned that the lives of autistic people and Down syndrome are less valuable. He also argued that his desire to die is usually triggered by fear of suffering. His family said he was not afraid to live with a loss of dignity, because in case of paralysis or motor neuron disease, the situation was not always the case. He said that people were afraid of a terrible, but there may be a good